Hi everyone, I'm Stephanie Tsai. Welcome to the Toyota Solutions Studio. I'm so pleased to be joined by an exceptional woman right now and a former mother of invention awarded in 2015, Ting Shi, the founder of a company called ClickMedix. Ting, it's so nice to meet you. I want you to sort of describe what your company does, but basically what I understand is you connect people with healthcare specialists using mobile technology.
When I first started this idea, I was just a graduate student at MIT, and we were given a simple assignment that said, create a business that will impact over 1 billion people.
Oh, just that? Just providing healthcare to 1 billion people?
Yeah.
But you did it?
Well, started. But you know, when you look at a problem that is so big, you have to look at, well, there are not enough doctors in the world to ever cover everybody in the world.
Right.
So the only way you could do that is to enable and empower those around the patient. Those are the health workers, rural physicians, nurses, and also the family caregivers. So what the technology does, it's a mobile application with a web system as well, so that someone like you and I can read off on a mobile app prompts mimicking a physician's questioning of the patient to understand their symptom, to understand what they're going through, and this information is then uploaded securely to the doctor, who gets an app notification that says you have a new patient request.
Okay.
And then they can provide diagnosis as well as treatment advice that can then be carried out wherever the patients are.
Okay, so here's a question. Besides, obviously, when you go to the doctor asking you questions, sometimes there are x-rays and scans.
Right.
So what do you do to address that in the app?
So they are facilities where they can go to get the x-ray and scans. And a lot of times when you look at, say, we just did a study for a community of over 10,000 people in India. And we simply had a questionnaire that took 3 minutes to ask by a health worker. They were actually students in public health.
Okay.
And we were able to screen that about 30% of them have diabetes.
Okay.
And they actually went and were referred to doctors to get their formal diagnosis. So with just a screening questionnaire, you can actually find a large portion of people at high risk.
Okay.
And then you refer them to the treatment centers. So if you look at the cost of, instead of having everyone at x-ray, just the ones who need it, go and get the x-rays.
And from my understanding is if you are one of the people that needs an x-ray or further scanning, your app actually has a way to transmit that data to a specialist somewhere.
Exactly. That, and we're adding on to a suite of devices, so ECG for heart rate, and others for blood testing. We can do HIV, malaria testing, TB.
What's the impact been so far? Where is this technology available?
Yeah, we're deployed in 18 countries. We serve over 300,000 people. It's in US as well as far as India, as well as sub-Saharan Africa.
Where are the needs the greatest for this kind of thing? And I imagine it is actually relevant in rural areas of the US or places where doctors are dozens of miles away. It's hard for sick people to get there.
The needs is everywhere. If you look in the US, our healthcare costs are so high, and just caring for patients, say, after the hospital visit, there's a whole suite of things to do. And what we're doing in the US is to enable home care agencies as well as caregivers themselves to give care to the patients post-discharge.
And how do you bring the healthcare providers on board? How does that part work?
So they are actually our partners as well as customers. They use our software to deliver the care to more people they want to serve. At the same time, they can also identify patients who really need to come to see them, or the ones who can be cared for remotely or at a more satellite local facility.
It's incredible to hear such a simple idea having an impact already on 300,000 people. And you started the company when? I mean, you won the 2015, or you were awarded the 2015 Toyota Mother of Invention grant.
Yes.
And already 300,000 people. How did that grant and the recognition you received from that help to propel the mission and the company forward?
Since getting the grant, we've reached over 100,000 more patients than before. We're in 3 more countries, 3 more regions actually. The Middle East is another region that we got into. And the grant has helped building more easy to use tools like secure chat and making it just...
Right, because that privacy aspect is so important.
Exactly.
And I would wonder with this sort of new telemedicine world whether my information is secure.
Exactly, exactly. So we built in patient engagement tools, we built in big data type of analytics. So that really helped us making it so easy to use. You and I can use it for our families. My parent could use it, and the caregivers could. So, you know, just more and more people around the patient can help act as if the physician's there with the supportive physician remotely.
I want to go back and dig a little deeper into your personal story and how TING became what you are, which is a business owner, but I assume you have a technical background as well. So at MIT, what did you study?
I studied MBA as well as systems engineering.
Okay.
And before that, I was at Carnegie Mellon for computer science.
Okay, so you've got like that 2 sides of what can make a really successful startup in that you have the technical engineering background and you have a master's in business. What is your advice for young women and even young girls? Like, my question to you is, how do I get my 6-year-old daughter to do what you're doing, which is impacting the world, using your full intellectual potential, and building something new?
Yeah, I think with today's world and all the information at our fingertips, we can almost learn anything off of YouTube. I think the difference...
Really? That's your advice? Go on YouTube?
No. The advice is we don't have a dearth of information, but partly for women, especially little girls, is a bit of bravery. The fact that they can do it.
Yeah.
It's the difference between boys and girls.
Yeah.
And I think, you know, that's my actually biggest learning throughout my whole really long academic journey is that I can do it. Just go and do it.
Did anyone tell you that, that you could do it, or was that something you just intuitively discovered on your own, that courage?
I think business school environment helped because that's just what you do. Everyone's doing a startup. So you just feel like it's the norm.
Yeah.
Yeah, but I think in an environment where startup is the thing to do, it's the norm, you just kind of get into it. I think that's part of it.
Right.
And
what about role models that you might have had growing up?
My mom.
Tell me about your mom.
She was an entrepreneur. She didn't tell me this literally till a few years ago.
Really?
So I didn't know she was an entrepreneur. She got out of college. She started her own business in import-export in Taiwan.
Okay.
And then she realized she needed to learn more, so then she joined a company. And then we all immigrated to the US, and she was literally working in restaurants, trying to make a living for us. Wow. And then she realized she needed to do...
She had a college degree, but did she have to start back over when you moved here?
Just to, you know, you're not licensing anything professional. You didn't go through education system here, so you make what you can.
Right.
And then she finally transitioned into mortgage and literally learned everything there. I mean, her journey is just amazing.
Her immigrant story actually sounds really similar to my parents when they also came from Taiwan, which is that a lot of times you have all this education, you have this expertise, but when you move to the U.S., even though it's a bed of opportunity, you have to take a couple steps back.
And you have to earn it, and it's hard.
That's such a great lesson, though, for a little girl to see her mother working that hard and making that kind of difference. Where would you like to see ClickMedix go from here? What are your goals and dreams for your company?
Well, I definitely want to serve over 1 billion people.
You're getting there.
Yes, and I realized it's actually a life's mission to do. It's not a 3-year and exit and it will happen. Yeah. I want to improve health for people, and I want to empower people like you and I, little girls, or to actually deliver that care better as well.
I can see that this is something you're passionate about, that you feel in your heart. Tell me, where does the creativity and the innovation, I'm always curious where that springs from in a person?
You know, I'd say it's really, so when I started trying to figure out what to do, I backpacked across Africa. I went to different clinics, and I was prototyping this mobile application on a Nokia phone at the time.
Because that's a key part of the whole invention is
Yeah,
that it
yeah.
starts with just a smartphone, right?
Yeah, I was shadowing doctors who were traveling to Africa and working with them as they went back to the US and seeing if this mobile application would work. So I don't know how creative it was just mimicking, understanding what's happening now and iteratively figuring out what is the solution that will work. It didn't get created off of a vacuum. It literally was just
you
seeing.
identified a problem,
Yeah.
and then you found a solution. Now, have you been back on the field in Africa?
Yeah.
Have you been able to see? Tell me some of the personal stories that have made the journey
Yeah.
worth it, that have sort of solidified, you know, your mission.
Yeah, I was just in India about 2 months ago in the Rajasthan area, which is all desert. And there is where we were doing the diabetes screening.
Okay.
And we actually visited one of the homes. It's a father, mother, and they're like about 60 years old or so. And they had the student interns knock on their door and ask them a few questions. And they realized their diabetes is a lot worse and that there is treatment and that they should just be on a medication. And since then, they look forward to the student interns coming and just learning more about the disease, where you think people would know about their own disease, but no, there's a lot of education that needed to happen and getting the right care and following the doctor's regimen and knowing that's how they can stay healthy. And not only that, the husband's wife also has diabetes.
Right.
So she's getting the same care through, one visit, and just seeing that impact, what a student intern could do with the mobile application to that one family and then extending to, the whole population. It's incredible.
It must be so rewarding. Ting Shi, I have to say, it is such a true inspiration to hear your path and your journey and where you've come. I wish you all the best of success. Thanks so much for stopping by in the studio.
Thank you so much. Thank you.